Running really keeps me sane. You know, I'm pretty busy. I'm a full-time physician and a mom. I always feel better after a run. I'm very close with my parents. I've always been one of those people who calls them on a daily basis almost and has a chat with them when I'm in the car. Or even when I was in college, I would talk to them on a pretty daily basis. So my mom was diagnosed with breast cancer in her mid-50s. And thankfully it was caught early on a screening mammogram, and she was able to, you know, she's been cancer-free for 10 years now. And I got to really see firsthand how emotional of an experience that is for women. I got my lifetime risk calculated when I was 35 years old, and my lifetime risk was around 25%. And in the first 3 years of my screening journey, I had 5 biopsies, and all of them were warranted, all of them were necessary, and thankfully all of them were benign, but it just really felt kind of chaotic and like I didn't have a lot of control in that situation. And so I made an appointment with one of our breast surgeons here. They were just really comforting and reassuring. I have not been diagnosed with breast cancer, thank goodness, but I'm having a mastectomy to reduce my risk of developing breast cancer in the future. I did my research, I talked to the people I want to talk to, I feel prepared, I feel well informed. It's just empowering to me to be able to make that choice for myself and realize that it's the right one for me.
Today is the day of the surgery. I thought I would feel more anxious and fearful today, but I'm actually pretty relaxed. I think I just know I'm going to be in really good hands, so I'm feeling good.
From a post-op perspective, I'm just moving a little gingerly, but my pain is really under control. I've got 2 drains in place that they've been emptying.
Good morning. It's the morning after surgery, so about 24 hours out. I was discharged today. I learned how to strip my drains and empty them and record the output on them. Part of the instructions for me were that I'm supposed to keep my bandages on and clean and dry for a week. Good morning. It's the second day after surgery. My hair is really greasy, and the only thing I can do to put my own hair in is to put pigtails in. So I've done that. I got a hat on the head covering the grease, but there's a beautiful sunrise. And just still recovering.
I made an appointment at a salon to get my hair washed and styled just because honestly, having that greasy of a hair just made me feel gross, and so I feel so much better now that my hair is clean. I feel more human.
Last night was the first night that I slept in my own bed. Before that, I was in a recliner.
I had my follow-up appointment with my plastic surgeon yesterday morning, and everything's going well. It's an adjustment. I woke up and I was feeling kind of sorry for myself. I took a moment on the side of the bed, cried for a couple minutes. My husband rubbed my back. You know, I'm just kind of sick of being a patient at this point, which I think is a very normal feeling, and it will pass and I will get through this. And, you know, humans are resilient and this is all temporary, but I just wanted to normalize that struggle. I wanted to hop back on because I did want to give a shout out to my plastic surgeon's nurse. Yesterday, right after the bandages came off, she just got this big smile on her face and said, "Oh, you're starting at a really great place. They look great." And that was just really nice for her to do. And we just have such great nurses at Sanford. And the kindness and compassion and that extra moment, extra smile, extra encouragement that we can give patients just means a whole heck of a lot. So yesterday was exactly 3 weeks from surgery, and my output finally became low enough to get my drains pulled yesterday. And I'm gonna go back into the office full time starting next week, which will be almost 4 weeks after surgery. I feel like I'm easing my way back into normal life. The incisions are probably now considered incision scars rather than actual incisions, so scar tissue's forming. Things are going really good, and excited to be back at work.
Hey, so I'm about 7.5 weeks out, and I just finished my first run post-surgery. Got to start somewhere. Feeling almost back to normal. Just some mild tenderness at some point sites where the drains were, but otherwise I feel very close to normal, which is really great. Just really happy to be on the other side of it. 100% love my decision, and glad to be getting back into my life. So there you go.
It is really about empowering women. I want this message to be, we're here, we got you.
Be a good boy.
Running is really the time that I just get to be for me. I'm not wife, I'm not mom, I'm not doctor. It helps remind me of the beauty of every day.